therapy,
cell therapy,
Gene therapy.
Gene therapy.
Gene therapy
Of cell therapy.
Do you have any idea about gene therapy and cell therapy? Gene therapy manipulates a patient's cell using a genetic material or DNA to cure an inherited or acquired disease. It aims to change or introduce genes into a patient's body in order to cure, prevent, or potentially cure disease by allowing doctors to treat a disorder by altering a person's genetic composition rather than using a medication or surgery. Examples of gene therapy approaches include replacing a mutated gene that causes disease with a functioning copy, as well as introducing a new, correct copy of gene into the body.
What is cell therapy?
cell therapy is an infusion or transplantation of a whole cell into a patient for a treatment of an inherited or a required disease. Regenerative medicine also includes therapeutic tissues, engineering, and biomaterials. Engineering substances for medical application to augment or replace a natural body function. Cell therapy is the introduction of new cells into a patient's body to grow, replace, or repair damaged tissue in order to treat disease. And there are different types of cells which can be used as cell therapy, including stem cells, lymphocytes, dendritic cells, and pancreatic islet cells.
Cell and gene therapy represent the overlapping fields of biomedical research with similar therapeutic goals which target the DNA or RNA inside or outside of our body. These approaches seek to modify genetic material to improve functioning or fight disease.
How does gene therapy works? Gene therapy works by replacing and inactivating diseases-causing genes. In some cases, gene therapy introduces new genes into the body to treat specific disease. If the genes are directly introduced into the body, they do not work. So in order to deliver the genes, a vector is needed. One of the best examples is the virus. Before the virus can be used to carry the genes, it is first modified to remove its ability to cause an infectious disease. So the vector infects surrounding the tissue of the cell, then the affected cells were removed, modified in the laboratory, and injected back to the patient.
Strategies of gene therapy.
What are the strategies for gene therapy? Gene therapy refers to the introduction of exogenous, which is normal genes, into target cells to correct or compensate for the disease caused by defects and abnormal genes. To achieve the purpose of disease treatment, at present, it has shown great potential in the treatment of cancer, genetic diseases such as thalassemia, sickle anemia, hemophilia, and congenital amaurosis. Cancer and rare disease are two areas with the most current clinical research on gene therapy. Considered a great potential cure according to the Pharma's Project statistic in 2018, the current application areas of gene therapy mainly involve cancer, monogenic disease, cardiovascular disease, infectious disease, and more.
What are the uses of gene therapy? The uses of gene therapy are it replaces genes that are missing or defective to treat a genetic disorder. It also delivers genes that accelerate cancer cell destruction and provide genes that help cancer cells to return to normal cells. In addition, it delivers genes that allow injured tissue to repair. Moreover, it provides genes that boost or impede new tissue formation. As a form of vaccination, it transmits bacterial or viral genes.
What are the common types of cell therapy? The most common types of the cell therapy is blood transfusion and the transfusion of red blood cells, white blood cells, and platelets from a donor. Another common types of cell therapy is the transplantation of hematopoietic stem cells to create bone marrow, which has been performed over 40 years. Blood transfusion is a routine medical procedure in which donated blood is provided to you through a marrow tube placed within a vein in your arm. Hematopoietic stem cell transplantation involves the intravenous infusion of hematopoietic stem cells in order to establish blood cell production in patients whose bone marrow or immune system is damaged or defective.
Thank you for watching.